Okay. The Evidence-Based Center Practice Center at AHRQ, which is the program that I am speaking about today, is a program that summarizes and explains research that's taken place in reviews. So it really is doing this for federal agencies, for medical professional societies, and health systems as a large. And what we're doing is trying to get this evidence put together so that these professional societies and federal agencies can make better healthcare policies, make better clinical decisions, really overall healthcare decisions and clinical guidelines, with the ultimate goal being really to leading to longer, healthier lives of all Americans. So the program was established in 1997, and what it does is we don't actually do the evidence reviews, we oversee the evidence reviews. So we contract with other large university evidence-based practice centers housed at large healthcare centers like the Mayo or university levels, and they actually do the reviews. They're awarded a contract. It is a 5-year contract, and they actually do conduct the evidence reviews under our direction and supervision. So this is a little bit of a busy slide, but it kind of gives you an idea of what are we doing. So we're working with research funders, with guideline developers, and healthcare policy makers. They're the ones who actually need research and evidence. And what happens is we actually conduct the reviews. These different entities will use those reviews, and it will inform either their research agenda. And what that basically means is, what are they going to focus on, and what are going to be their research priorities? What kind of research should they be doing in the upcoming years? Or they'll use the reviews that we produced to produce clinical practice guidelines. And I'll show you some examples of that in just a minute. Or coverage decisions. So that's really what it is about. Again, all about improving the healthcare in the United States. So let me just give you a little bit more information about what actually is an evidence review. So what happens is we do not actually do research ourselves, but what we do is review the literature of research studies that have already been conducted by others. And then, so when you're making a healthcare decision, you're not going to do it based on one research study alone. There really needs to be multiple research studies that have the same results, that give you the best evidence to be able to say, yes, this is really a good healthcare decision, a good guideline. So what we do is we do a comprehensive review of the literature. We synthesize that literature, make sure we critically appraise it first, like, is it a good quality research study that has been conducted? We summarize and synthesize that information, and then we use that information to identify what are the harms, what are the benefits, how does this compare to other healthcare practices? And that is how we come up with a final report that is then produced so that others can use that to inform the direction that they want to go. So again, it talks about, it helps to identify advantages and disadvantages. Does that practice work better in certain settings and population? For instance, is that only effective in rural settings or in urban settings, or different things like that? Is it specific populations of people that it really is effective in, or what is missing? And they use that information to make decisions. So here are a couple examples of how that evidence has been used in the past. So we've previously partnered with CMS to do an evidence review, and it was because of this evidence review that we did that CMS decided that it was okay, and it informed their decision to cover acupuncture for non-specific chronic low back pain, and that was based on one of our evidence reviews. Another example of an evidence review and how it was used was the CDC used one of our evidence reviews to develop clinical practice guidelines for prescribing opioids for chronic pain. And we've heard a lot about opioid use over the years and some of the abuses associated with that. But the clinical guidelines that the evidence review that we produced was instrumental in informing the CDC and them producing their guidelines for opioid use, which resulted in a reduction of opioid prescriptions. So I wanted to kind of share with you a couple of other topics of interest. This is a wide range. This is by no means the comprehensive list, but it gives you an idea. These are topics that are either finished or in development currently, and you can kind of see how what this looks like. Looking at evidence to address strategies to address racial and ethnic disparities in health. So there are certain populations of people who have poor outcomes for different disease processes. So this evidence review is helping to inform that. Looking at COVID-19 pharmaceutical treatments, the adverse events associated with them, medical care in adults with Down syndrome, and that goes over some of the best ways, the advantages and disadvantages, pros and cons of treating those adults with Down syndrome. And cannabis use. So we hear a lot right now about cannabis or marijuana being legalized in a lot of states. But this is a report that studied cannabis and other plant-based treatments for the management of chronic pain. Some of the other ones related to mental health in children and adolescents, interventions to improve care of bereaved persons, healthcare delivery for persons with disabilities, and one that's currently underway, which is an evidence map of home and community-based services. So basically avoiding having to be placed in a long-term care setting. What is the advantages and disadvantages, information out there about those services that are being provided in the home and in the community to keep people in their home for longer. So this is just a little bit about why are we coming to this group specifically. This is an important part of our partnership. And our partnership is really about, we need to hear from you from a lot of different ways. Right now, we have open topic nominations that is through March the 30th. So topic nominations are open year round, but we do have a deadline, which is the March 30th, the end of the month, which will fund and inform this current budget year. So we're interested in hearing from others. What do you think are topics of interest? What are the healthcare topics that you think that AHRQ should be studying and looking at and reviewing? What evidence reviews? So this is how you can go in and put in your suggestions for topic review. You can scan the QR code here on your phone. I'm going to share the presentation after so that you'll be able to have access to it. But you can go onto this website and suggest a topic. And I'll take you through what that looks like. This is the information that we need if you're going to suggest a topic. And I'll just give you a random example. Let's say there's a lot of conversation about plant-based diets, right? And let's say you're interested and you think that AHRQ should do a study about plant-based diets and the benefits of it. So what you would do is you would go onto that website and you would say, I'm interested in plant-based diets. Why is that important? And you would just, you don't have to think about this. You don't have to be a scientist. You don't have to be a physician or healthcare professional. You just can put down what it is from your perspective. Why is this important? And you may say, well, because I'm confused. There's all these different diets that are out there, and I don't know which one has the best health benefit. So that's what you would put down. And then you want to suggest who will use it, because this is an important part for us. If there's nobody to use the evidence review, then it's not likely going to be a priority. But you might say, who's going to use this information? Consumers would find this very interesting because there's a lot of confusing information. But maybe you might say the USDA might use this because they're the ones who create the food pyramids for us, and being able to share what types of agencies that might be important. So who this might be used for, why, and the other thing is what other stakeholders could use it. Like I said, consumers, AARP maybe, your organization, just the more you list, the better chances you have of this being something that will be prioritized. And if this is probably less relevant for you as an organization, but this is a question we ask other agencies. So if we're working with CMS or another federal agency, we may say, how soon do you need this? Because that helps us to know how to prioritize it if we can get it done in time. These reviews are not quick. Some of them take a year or longer just to get through all the evidence, but some can be shorter, just depending on the type. Some can be done and produced in a few months. And this is how that process works. So first we get the group of nominations. Then we look at all the nominations to make sure that they fit the criteria. Is it a healthcare topic? And then we prioritize which ones that are going to be funded for that fiscal year. And then it gets awarded and we really start the review. So this is the actual selection criteria. So this is the criteria that we use to determine whether or not a topic is going to be prioritized. First, does it fit into the mission of AHRQ, which is helping to improve the life of Americans, right? Really just that basic information there. And what is the level of importance? Is this a big cost burden issue? So as you could imagine, for instance, when COVID-19 came out first, that was a big level of importance because it was a significant burden, significant public health interest, which is why we funded evidence reviews on COVID-19. We also look to see, is there any duplication? So for instance, I'll use the example I use for plant-based diets. We'll look and say, have we ever done an evidence review on that? Well, the answer is no, we haven't. But, is that information already out there? Because we don't want to spend money doing a review that's already been done. And then we look at the impact. And we say, if we got this evidence, what is a good way that could this address any clinical uncertainty? And so we look at that. We also look at the feasibility. Like, what is the volume of the research study? Is there even enough? Some topics are so brand new and they're so cutting edge. There hasn't quite been enough evidence yet to even be able to do an evidence review. Or is the volume so great that it would take like 2 years just to get through all the evidence? So we look at that. And then finally, we look at the value and how would that be used? And could those findings really implement or make changes in practice? So kind of some important criteria that we look to and evaluate. And finally, I'm just going to leave this here, this slide here that talks about getting involved. If you find that, maybe I don't want to suggest it, maybe I'm not quite sure that I want to suggest a topic, but I am interested in hearing more about what these topics are and what exactly is AHRQ doing in these evidence reviews and how that might affect me. You can, again, scan this QR code, and sign up to get updates from the listserv. And so what'll happen is we will then send you an email at every step of the way. So you'll know what's going on at AHRQ, what types of evidence reviews are actually taking place. And there's actually an opportunity if you want to get involved with providing comments about questions in the draft report. So I'll give you an example. The Home and Community-Based Services report is currently underway and is actually open for public comment. The draft report is currently open for public comment. So let's say you're particularly interested in programs and services that keep patients or persons in their homes for longer without having to go into long-term care. And it gives you an opportunity to go in, get information about that report, read the report, and weigh in and provide your input. The patient perspective is very powerful and it's very important. We hear from clinicians all the time. We want to hear from patients too. Your voice is important because after all, you're the recipients often of the care that we're really doing research on. So this is a way to kind of stay informed and be up to date on what's going on. And lastly, I have my contact information here. This is the website for the EPC program, my contact information, as well as one of my colleagues. So I just want to pause for a minute. I kind of went through that quickly and didn't want to take all your time today, but I do want to open up and give you an opportunity to ask any questions.
Great. Thank you so much. I agree with Bill in the chat. It's just really great to learn more about AHRQ. It's always been in the environment, but not really understanding this particular program and opportunity. So yeah, if anybody has any questions, you want to use the raise hand feature or come off mute.
I also see in the chat there a suggestion about the beliefs about saturated fats being bad for you. I encourage you, absolutely. Those are great ones. I definitely encourage you to consider nominating those.
And I think John.
Can I ask you a couple of quick questions?
Mm-hmm.
Sure.
How many submissions are you like reviewing on an annual basis?
Yeah, that's a really good question. It does vary from year to year. We can get maybe anywhere from 80 to 100 submissions. And we, some years it's less, maybe 20. I should note that the federal government does not, when federal agencies request reviews, they're not in that bucket. So the federal agencies like CMS or the CDC or FDA or whoever, they actually pay for their reviews separately. So they don't have to nominate their topics. So when we kind of take those out, it may be as few as like 20 or so. And then from that, we may then pick only a handful. There's not enough funding. It just depends on how much funding we have available for that year and how big the reviews are. Large reviews obviously take more money, smaller reviews are less. So it varies from year to year.
Okay. And the other question I had, with submitting the topic, can individuals or can groups get more involved with the whole process of helping do research or helping find the information and supplying more information to you?
Yes.
How does that go?
Yeah, so if you nominate a topic, if someone nominates a topic and that topic then gets selected, we reach back out to you and we allow you to be involved in the process from start to finish. So you get an opportunity to weigh in throughout, provide comments throughout, provide a little bit more context around why you nominated that topic and why it's important and things like that.
Okay, thank you.
Mm-hmm.
Great questions. Thank you. And Angela, we had a request to put the contact information into the chat if you have a second to do that.
Yeah.
And Anthony, did you have another question?
Yeah. I know you said you didn't get directly involved in the research, but what is used to validate the research that you use to make your decisions?
So you're right. So we don't actually do the research itself. We review the reports of the evidence review. So one of the reasons why people come to AHRQ is because they trust our process. We have a very systematic process for making sure that the evidence and the research studies that we include are high quality and valid. So so there's a process when you start off the review, for instance, we may look at 200 studies. But then when we look at all those studies, some of them are not necessarily conducted with what the research community considers high quality. In that case, they may be excluded. So you may start off with 200 studies, but by the time you get down to the final review, it may only include 40. If that makes sense. Hopefully I answered your question.
Yeah, is there an opportunity for patients to get involved in the validity of research?
Yes. So not necessarily getting involved in the validity of research, but your comments are very, very critical. So what we're looking for you is to, again, if you sign up for the listserv program, if you sign up for that, that would give you an opportunity to comment when something is open to the public for comment. We welcome that. You want to definitely comment on when you read the report. Does it make sense? Do you have additional questions afterwards? Did you feel like we missed something? Did you leave something out? You may have a specific situation that is pertinent to you and others that you know that the evidence review didn't include. Well, we want to know that too. Sometimes it's because the research did not include that. And so one of the things that each of our reports also includes is evidence-based gaps. So we did a review, for instance, and we came up with these conclusions, but let's say, for instance, the evidence was not really clear for how this applies to people who live in rural communities and don't have easy access. And so one of the things we also do is we call for research. We're asking those who are in the research community to please consider doing research to fill these gaps in and conduct studies so that we can have answers to those types of questions.
That's great.
Yeah,
Thank you.
such a robust process, right?
Yeah.
That's amazing. And we've got a couple questions in the chat. One, how are the reports disseminated to the general public?
So they are publicly on the website. So you can go to the epc.gov and you can get access to any of the reports. You can do a search. And I'm going to pull up the evidence, just pull up a quick screenshot so that you can see it.
Great, thank you.
And share that with you. This is the evidence-based site. So it's effectivehealthcare.arc.gov. And here on the landing page, this is the information about nominating. It tells you what the topics are that are most recently released. You can kind of see what those are. You can also go into the evidence reports here. There's an opportunity to provide input and, provide comments on different things. So this gives you a little bit more information. There's health topics that you can search. So hopefully this might be a decent resource for you. And I'll copy that website and put that in the chat for you as well.
Thank you so much. And then Ting had a question of how often the reviews are of health policy.
So that just depends. It really does vary because they do take a long time, maybe a year or so. It really does vary. So there's not really a cut and dry answer. What will happen if there's a federal agency that is looking to develop a health policy, or even a professional organization. So you may have seen when I shared the screen, respectful maternity care.
Mhm.
So the organization of obstetrician and gynecologist physicians may have nominated or requested that review be done. And they will use that information to inform how they do guidelines. If a federal agency is working on a project or a health policy, they may reach out and ask us to do an evidence review before they make a decision on informing coverage guidelines or informing, any type of clinical decisions or policies and things like that. So it really does vary. There's not really a exact number from year to year.
Thank you. I'm going to take another question from Rosie, and then I really want to learn what you guys are thinking about and how you're responding to this as well. Go ahead, Rosie.
Well, first of all, I wanted to thank you for being here, Angela, but I have to tell you that I signed up for, and I don't even know when I signed up for it, but I get like a daily, almost daily report from you, and it's often about topics. Like it might, one of the latest ones was innovations in digital health, or it might be behavior, and then they give you all of the research they've done in that area, and articles and things. And then the other thing that I'm connected to is PSNet, which is also another program that you provide materials through, and your research through. So so that they just have, I probably get one a day at least from you, if not more, about different topics. And I don't always get to read all of them, but if a topic is important to me, I put it aside and find time to read it, because it is lots of quality research. So.
I'm super happy, Rosie, that you are engaging in that and you're doing it exactly the right way. It is not our expectation that people read every single report that they get. You know, everybody is not interested in everything. But you're exactly right. You can go in and, you know, mentally put away the ones that are not necessarily relevant or of interest to you, but at least you'll get an opportunity to hear and be notified when something comes along that is of interest that you can dig into a little bit deeper. So I appreciate you engaging with us.
Thank you. Well, this is, you know, as I said, you guys, I had a conversation with Angela a little earlier and my brain was just bursting with ideas on not only did I want to bring this to you as individuals, but how can the PFA network suggest some topics as well? So I just, by show of hands, either virtual hands or real hands on the screen, how many of you are thinking of topics right now? All right.
Awesome.
So what I'd like to do then is just take a moment and we're going to do a waterfall chat. I don't know if any of you have been on a waterfall chat before, but what I'd like you to do is type in to the chat your top 2 priorities. Let's go with 2 for the group right now. Chat those in, but don't push send until I ask for it so that everything comes in at the same time. And the reason I want to take this approach is because I want to see if there's overlap in what all of you are thinking. And then I will share a couple of our thoughts as well. So does that make sense? Any questions about how you do that? Okay, so take a minute or two and put in your priority topic areas. Doesn't have to be super detailed, just 1 or 2 statements and hold it until I say.
Oh.
It's okay, Anthony. And while they're all doing that, Angela, I just want to get clarity. Like you were flashing lots of topics that are in process right now that are very germane to what we're doing and very important to us. And so the commenting is the opportunity for us to say, yes, go after that one. Is that right?
No, those are already in process. So
Okay.
you don't have to weigh in on about whether you think it's important, but this is an opportunity to say, for instance, if they're so the way that research goes is the first thing that you do is identify key questions. Like what questions do you want answered when you do this evidence review? Like what is the population? What is the setting, rural or urban, you know, population? Is it older adults, younger adults, males, females? You really kind of narrow that down. And then you ask questions like, what are the health benefits? What are the disadvantages? What are the side effects? What are the harms? You go through a series of questions. So the first opportunity for public engagement is when those key questions are posted. And then the public looks at them and says, oh, but you forgot this. You know, you forgot this specific population. You should be asking question X. You got some great questions, but you didn't ask this question, you know. So that's one opportunity to really engage. The other is sometimes we will have panel discussions. And so we're looking sometimes for the patient perspective, which is one of the ways that I plan to leverage this wonderful relationship that we've done. When we're looking for our patient perspective, I may reach out to you and say, we're holding a panel that's going to talk about whatever. We did a panel, for instance, for home and community-based services. That's done, but I may have reached out to you to say, do you have any patients that you think would like to serve on this discussion? And then we just have an open conversation and we hear about your perspective, and that informs the direction we go when we review the research. So then finally, it's the draft report. When the draft report gets posted, again, the home and community-based program report is posted now. You can read it and weigh in on what do you think it says and things like that. So those are the opportunities.
Thank you for the clarification. I appreciate that. So, and just so exciting to see that there's many touch points that we have the opportunity to engage in. Nadine, I'm going to hold your comment for 1 second. I'm going to let everybody who hasn't already put their items into chat, and let's see if we have any themes that kind of come up.
Do you want us to go ahead and enter 'em?
Yes, please.
That's all I wanted to know, Libby.
Oh, sorry. All right. So it looks like we have a wide variety of topics in here. And so I think what I'd like to do is spend some time. I'm seeing disabilities jumping out a little bit to me. And I'm seeing a little bit about a topic that I have been talking with a lot of patient family partners with, as well as a lot of partners with, and that is around out-of-pocket expenses and the burden to people. You guys might remember Teresa, who co-hosted when she was at Discern Health, who co-hosted our last PFA summit with us. Her group has done a report, a preliminary report, really looking at the burden to individuals, patients, and families around out-of-pocket costs. And I think all of us can agree that that is certainly an issue. So that's something that I'm thinking about moving forward in this process as well, as a sort of consensus from the PFA network. Just any feedback on that idea?
So I just want to share with you, just remember that these topics have to be healthcare related. So I know that that is a healthcare indirectly, because cost definitely affects outcomes. So when you frame it, you need to make sure you're framing your recommendation or your topic suggestion in the frame of a healthcare decision. And does that make sense?
It does make sense. And I think that's pretty easy from the findings of the paper that Teresa Schmidt led, which is the number of patients that defer care. They can't go to care. They can't get care.
Yes.
Because they can't afford it. So yes. I think that would be the tie-in. Thanks for that prompting question, because that helps me to clarify for the group too. So yeah.
Also, changing poverty levels is directly responsible to what you just said. Okay, because the levels that they're currently at create the out-of-pocket expenses. So
thank you.
And going along with
Yep.
also the social determinants of health. Many times people who have never experienced them experience them because of healthcare. So it's, you know, it's because of the cost of the healthcare. They have other issues and other issues, you know, and you have to make choices in your life that you never had to make before.
So just to help you frame it a little bit, you might want to think about healthcare delivery for those with, you know, blank, you know,
Okay.
incomes below the poverty level, or, you know, lack of resources, things like that, or interventions to improve care for persons with, and then you can define off. So that's how you make that connection to a healthcare topic.
Thank you. I really appreciate that.
I noticed somebody else mentioned sepsis and post sepsis. And I think that is also, I do a lot of work in it. I've done a lot of research from the patient's point of view, not so much always from the healthcare provider's point of view, but from the patient's point of view. And I've done some presentations here in the coffee chat a few times. And I just believe that, you know, the longer you deal with sepsis and the more sepsis I've been running into, not only with people who have chronic disease, but also in chronic illnesses, but healthy people who end up in sepsis from things like an ear infection that got into their lymph nodes and caused them to go septic. I right now have a granddaughter in the hospital because she got a scratch on her eyelid and it's now caused sepsis.
Wow. Rosie, thank you as always for sharing your experience and really driving home the importance of getting the patient and family voice into these priority discussions. I mean, I think that's what excited me so much about my chat with Angela and her colleagues, and why I felt so compelled to bring it to this group. Nadine.
Yeah, real quick, Rosie, I applaud you as always, all these years, but it's so nice that you pointed out some examples. That's what storytelling is so powerful, so powerful. But the thing I want to say quickly, I'm like a dog with a bone, and I would not let it go about the post-sepsis syndrome, which Epic in their EHR system, whatever the heck it's called, has that pamphlet and is given out all the time now. So people don't think they're crazy and can't make the
Right.
correlation between sepsis and recovering because it lasts up to a year.
Mhm. Or longer. Yeah, okay, thank you. Thank you, Nadine. Other comments? I see Linda sharing a resource. Thank you. All right. Angela, any other comments from you or questions or anything we can do as a group to support your efforts?
No, I appreciate you guys have been a very attentive audience and your comments are very relevant, only making the case of why this group is so important. And I really, really appreciate you taking the time to invite me, first of all, but then to be able to listen so attentively and provide such good comments and feedback. I appreciate you all very much. This will not be the last of our connections. We'll stay in touch for sure.
I'm very glad to hear that. And you guys, you know, I've struggled to manage the technology aspect lately. And so the fact that Angela persevered through me giving her the wrong date initially and then the wrong login. I mean, she was really dedicated to hearing from all of us. So thank you, Angela, for all that grace and patience. I'm going to go real quick to Emily and then to Rosie. Emily?
Yeah, just one other question. One reason why I say I think it's important to have a review of the studies on gender affirming care for youth is because there's so much political controversy. And I'm wondering if that's one of the things that you take into account as you decide which reviews to do.
Oh, good
Yeah.
question.
That's a really, really good point. So like I said, when our team does the prioritization, they do take into account the topics that are really relevant and pressing at that moment. They do take into account public health burden and impact. So those are very important elements that they will definitely look at and prioritize.
Thank you. And Rosie?
And I guess one of the other points, and I know you mentioned that you are starting to look at this already, but disabilities, but on the other side of that, accessibilities and how accessible. And I just did a workshop yesterday with a couple people, some from Canada and some from the US. And one of the things that people don't think about is the accessibility from the parking lot. And how many van accessible spots do you have in your parking lot? You know, if you have people that are coming there with disabilities and there's only 20 spots and then you have to pay for valet, that is not, it's not right. It's punishing people with a disability. But I guess I want to make sure when we bring that to you, that we frame it right.
Mhm.
You know, why is this all, why is this, but it affects people because sometimes they don't go to their appointments because they can't find a parking spot, or they're late for their appointment and then they get told that they need to leave because they missed their appointment because they were looking for a place to park. There's all kinds of stories I'm hearing, and that's just the parking lot, and that's not even the bathroom or the table that I mean, when I go to my orthopedic surgeon, I have to book a spot in the casting room and also a appointment with him because the tables in his office do not meet my needs. So I have to book 2 appointments.
Yeah, so this is one of the reasons when you nominate a topic, one of the questions that they will ask you is, why is this important? And there's where you have an opportunity to really kind of explain really what the impact of the topic that you're nominating is.
Perfect. Thank you so much to bring this kind of clarity and this opportunity to us. And yes, I'm very hopeful that this is the beginning of a long and profitable or productive, I should say, relationship with AHRQ. Thank you for coming. Okay, guys, just a couple of quick updates. As always, we're seeking out, ways that we can communicate. I can tell you that the number of engagement opportunities is coming in so fast and furious, and we're trying to get them out to you as quickly as possible so that everybody can participate, everybody who wants to can participate. And please, when you see those opportunities, if you feel like, oh, I know somebody that would want to do that or get involved in that, pass it on. Please feel free to distribute to folks that you think might be interested as well. The forums is a place that we are using more and more because it's just an easy place to kind of post things. The other thing that I've revitalized in the last month is the LinkedIn PFA network group. So if any of you are on LinkedIn, you're welcome to connect with us that way. And anything that you want to share, anything that you, an article or an interview or a research paper, a resource that you want to share with the community, please feel free to go directly there and post it. That's the quickest way to get it out to the network overall. So just wanted to remind of the communication pathways. Other things going on, the DEI Leadership Council, we're talking with them about this concept of special topics. So you might remember in November, we had Anthony join us to talk about the unique needs of the Latinx population in the healthcare system. And that really kind of perked a bunch of new interest of different particular groups that really need to be heard from. And that we as a community, in order to be representative, really need to learn from. And so we want to continue to open space for those special topics. I will say that it's become something that we really want to take some time to be intentional about and base those conversations in a larger framework of what will we do with that information. We don't want to just have conversations and then not take action on it. We want to really understand how we can support underrepresented populations. So that is all to come. So keep your thinking caps on in terms of what those topics are coming up. But all right, any questions for me before we go? All right, well, I wish you a wonderful afternoon and a weekend and a happy St. Patty's Day.
You too.
Thank you.
Bye, guys.
Libby, are you still there?
I am.
I'm sorry I came in late. I missed how you can nominate a AHRQ topic.
I'll be sending out the recording and the slide deck Angela's going to send to me after this, and I'll be sending it out. It'll have all that good information.
Thank you.
She did put some things in the chat though, so you might want to just save that down.
Yeah, I saw. Yeah, thanks.
Okay.